Well, hello, I'm Doug Apple, back with another special interview for you today. And there's this conversation about, are you satisfied with your healthcare situation, your health insurance, how you're paying for your healthcare? Are you satisfied with it? Well, here's a headline. J.D. Power says why commercial plans should be investing more in engagement and education. And the reason is because of dissatisfaction among their people. And here's the leading sentence. It says, customer satisfaction with health plans is on the decline. I don't think anybody's surprised by that. Then it says, here's a quote, leading plans are setting themselves apart by delivering clarity, digital convenience, and member-first communication. Meanwhile, others are falling behind as trust erodes, digital tools go underutilized, and members struggle to understand their coverage. Well, we're going to dive into this just a little bit, talking with Mike Sharman. He's the legal counsel for Share Healthcare, the nonprofit healthcare sharing ministry, which you can find out more about at sharehealthcare.com. But Mike, it's probably not a surprise to our listeners that many people are dissatisfied with their health plans. So you've read the article. Talk to us a little bit about this.
Well, what I thought was interesting is they point out, J.D. Power points out that the average satisfaction score for people with their health plans was 563 on a 1,000-point scale. And then they're trying to, I guess, kind of make it better. They said there's a noticeable variation in scores based on geography and plan, with a high of 594 and a low of 523.
I noticed that, yeah.
Yeah. So you either get an F or you get an F minus.
Yeah.
Because, I mean, if this was an essay, nobody even got 60%, which, of course, is an F. So no one is satisfied. That's frustrating because we've had legislative fights since the early 90s, particularly with the Hillary healthcare plan when she was putting that out, and then Obamacare, of course, and then the adjustments to Obamacare and the expansion of Medicaid, all those things that were intended supposedly to make people happier with their healthcare plans, but instead just made them more difficult, more complex, put more burden on the states and federal government, and it made it much more confusing for people to know what to do. Some of those things that they pointed out were 48% of the people who were in this study didn't understand that their out-of-network benefits would have a claim denied. And 56%, majority, said their first choice doctor was not available in network. Now, just in case some of your listeners may not know, that a large amount of health plans, a large amount of insurers, and even some other healthcare sharing ministries have in-network programs, meaning you have to go to doctors in hospitals that are in the network they've chosen. And if you choose to go outside of that network, that's just your out-of-pocket. That's not covered on your insurance, or with the healthcare sharing ministries that do this in-network thing, is not shared as would a bill within the network. Some of the other things they point out here is the average deductible. The deductible is what you pay in your insurance, not the copay, but just nothing happens until you've reached over this deductible part. At small employers, the average was $2,847. For mid-sized employers, $2,619, and for large employers, $2,562, according to this survey. So those are all interesting things that lets you know how problematic it is for people when they're thinking, I'm insured, I'm okay, it's insurance, it's a contract, of course I'll get paid, or this bill will get paid. Well, no, not necessarily. And apparently, because you have to think even the people who are getting paid aren't happy when, the best somebody could do is 59 on their essay. Yeah,
so contrast that with Share Healthcare.
Well, it's a pretty simple contrast. For one thing, we've not really had a we don't do surveys, so I don't know, percentage-wise, but I do get a copy of every time that somebody has a concern, not necessarily a complaint, but a concern, because we have a very robust appeal process. Let's say somebody has an issue that might maybe pre-existing, because like pretty much every healthcare sharing plan, we do not do pre-existing. We just can't afford to do it. We're not an insurance company that has reserves. We're not a government that can just print the money. So a lot of time people don't know something's pre-existing, or they just submit their medical bill for reimbursement, not even thinking about it. And so if it's denied at our member service level, which is that first worker level, then when it is denied, they're told, okay, you can talk to your member advocate about this. And that's the first level of appeal. The member advocate has authority to do whatever, whether it fits the guidelines or doesn't fit the guidelines, because we're not insurance, we're church. We're just, to give people a short rundown of what Share Healthcare is, we're a 501c3 ministry, a nonprofit ministry, whose specific mission is helping people share their medically necessary medical expenses. And we do it in a relatively clear framework. It's for Christians. Christians are helping Christians. And because of that, we share within a biblical framework. We're not going to be sharing on things that God would not approve of. We don't share on abortions or abortifacients, or, of course, the transgender destruction type thing. And we also are within the borders of what's possible. So as I mentioned, it just isn't possible for us to accept everybody with pre-existing conditions or share in their pre-existing. Because, as I mentioned, ours is a money in, money out program. It's just, here's a need. We have the set amounts that people share, $149 for a single per month, $249 for a couple, $349 for a family of four, and then $50 for each child after that. And the money that they send in for sharing is put back out immediately that month for medical expenses. So it's disappointing that we can't share in pre-existing, and that will have a initial denial, let's say. It goes to that member advocate, and the member advocate can talk through it with the person, say, well, did you realize it was pre-existing? Here's what we can do. Our share power this month is good, not good, bad. We have the amount that we can share this. We don't have the amount. They'll talk through those things. And then that, like I said, the member advocate has the ability to share whether or not it fits our guidelines. Let's say they again say, no, we can't do this. It then goes next, the next appeal process is to the board itself, the board of Share Healthcare. And they have the ability then to do exactly the same thing, review it, decide, yes, we want to share this item, and we think it's appropriate, and so we can. But let's say they choose not to share it also. That member still has another appeal process, which is to 3 randomly chosen members who can do whatever they think is appropriate and right. And of course, each one of those levels, they're praying about things. So hopefully it's not their mind that is making the decision, but the mind of God. And let's say that third member panel again decides against the member who's submitting a medical need. We have a fourth level, which is going to Christian conciliation, and Share Healthcare will pay the expense of that. And then whatever that is done at that Christian conciliation process, that's that actual institute, Peacemakers International Christian Conciliation Group, then that one is the final one. So because of those levels of appeal, the person's need either gets met, even though it didn't fit the handbook, or they know that they have been heard, and that people honestly trying to review this have decided something against them, but they know they've been heard, and they've been heard fairly. So because of that, we really haven't had complaints on that score. We have more joiners than we have people who drop. People who drop tend not to be dropping because of dissatisfaction. They just they're moving on to something else or something different, might be going in the military, things of that nature. You were asking me to compare other things. So that's the satisfaction thing, which was the first on this J.D. Power. So I bet we do a whole lot better than 59 on a score of 100, 594 on a score of 1,000 satisfaction score. But since we don't do surveys, I can't promise that. The other thing was 48% of this people with insurance, J.D. Power found, didn't understand they had this out-of-network issue. Well, for people in share healthcare, the entire world is their network. Whoever is a licensed medical professional in the world is their network. Whatever hospital there is in the world is their network. Now, of course, the vast bulk of members are going to be doing things within the United States. But it's pretty helpful if somebody goes on a short-term mission or long-term mission or just goes off on vacation outside the nation to know that if they choose to, they can have their care being done outside the nation, and still those medical expenses are shared as long as we get the sharing in English, the bill in English. And kind of dropping back to the denial process. Pre-existing condition is one point that causes a denial, that we just can't share, this doesn't fit. More of the time, it's a technical issue. We need the full bill. We need to have it not just a receipt, your credit card receipt saying you did this and to reimburse, or just the bill from the hospital provider that they want us to send. We need what's called a super bill that has all the various codes on it, because a lot of times somebody's being billed for duplicates or for things that didn't even occur to them. So we want to have the chance to go over that bill and then properly reprice it. So that's one of the big reasons of, hey, you don't have a full bill yet. We need you to get that, or we can call the provider and try to get it for you, that type of thing.
Well, one last thing. You talk a lot about freedom when it comes to share healthcare, and there are a lot of entanglements when it comes to people buying health plans, for example. And I say there are entanglements, but you said you don't do surveys for share healthcare, but because you are very much operating in the free market without those entanglements that come with other health plans, so that nobody feels like they're entangled with share healthcare. What I'm saying is it's operating in the true free market, and in the free market, when you're dissatisfied, you don't have to take a survey to say you're dissatisfied. You leave. That's what you do.
Well, and thank you for bringing that up, Doug, because, when I first read this article, that was the first thing that occurred to me, is that people have a choice, really have to kind of actively choose to be a member of Share Healthcare. We're not on Super Bowl commercials or things like that. They have to have been heard about us normally from a family or friend, maybe seen us on the internet if they went searching for healthcare sharing ministries, but they've chosen to be part of us. And they know that it has these freedoms, the medical freedom, financial freedom, and religious freedom. And those are very satisfying things to us at our core. I mean, we all want freedom. Every human on the face of the earth wants freedom. And here in our luxurious America, where we have lots of choices, we do want medical freedom. We want to be able to choose, well, do I want to pay everything out of pocket myself and have nothing? Do I want to have insurance? Do I want to be on the healthcare exchange? On and on and on. What do I want? And having the ability to have a healthcare sharing ministry like Share Healthcare is a huge part of that. They want to know they have choice, that they can pay $349 with, by the way, that would be a personal per event personal expense of $1,000 as opposed to this, nearly $3,000 that we were talking about over here. And our $349 for a family of four is, as opposed to $2,600 average right now for these commercial plans that J.D. Power is talking about, is the monthly amount for an employer-provided plan. So just the fact that people are able to have a choice about it, and they know that they chose it intentionally, does, as you pointed out, Doug, really help them have satisfaction from the beginning.
Well, as we wrap up our time here, talk to the person who might be listening who is the most likely candidate to consider Share Healthcare and invite them in.
Well, I'd say it's a young single or a young couple, maybe a young family. I say the young because they're just starting out. They don't own their own home. They didn't buy it during the great economic collapse in 2008, 2009 when homes were cheap and mortgages were cheaper. They're really struggling. And being able to have this, one that helps them feel good about what they're doing, that as a young person, a young couple, a young family, they know that they're trying as best as possible in this healthcare arena to do what God would want, to be part of the church, sharing that way, and to be doing that biblically responsible. But then, of course, in that financial area, the difference between our $349 for a family or the $249 for a couple and the amount that they would be paying for insurance it's right about a mortgage payment. It's huge. And it either would be allowing them to do those things or to be saving up more, or if they do have the home that they want, it may allow them to have the mom come home instead of having to be a two-worker family. So I think the ones that this suits the best is for that young single, that young couple, and that young family.
And what should they do to find more information?
They can call 1-844-SHARE-HC, 1-844-SHARE-HC. And probably before doing that, they might want to do a little bit of their homework. Go online, look at it at sharehealthcare.com, sharehealthcare.com. Write up their questions, and then when they talk to the person at 1-844-SHARE-HC, they'll have their questions prepared. And that young single, that young couple, that young family, the ones that probably are the prime people that might want this are those that work for a small business or own their own small business that they wouldn't otherwise have a healthcare system provided for them. And here they have this system, which is the body of Christ around the world.
Very good. That's sharehealthcare.com or call 1-844-SHARE-HC. We've been speaking with Mike Sharman, the legal counsel for Share Healthcare. And for Wave 94, I'm Doug Apple.